Welcome. My name is Philip Martin, and I'm Senior Investigative Reporter at the GBH News Center for Investigative Reporting, and I'm also today's moderator. And I'm happy you're with us. Joining me today are Tabby Chavez. She's a professor of education and psychology and director of the National Center for Institutional Diversity at the University of Michigan. Also, we have Marvin Kriskalov, who is president of Pace University. We are talking also with Josephine Kim, a member of the Faculty in Prevention Science and Practice and CAS and Counseling Programs at the Harvard Graduate School of Education, and Meeta Kumar, Director of Student Counseling at the University of Chicago. Now, Marvin and Meeta are also members of the Steve Fund's Crisis Response Task Force, which was formed to address the particular impacts and vulnerabilities of the pandemic and other factors on the mental health and emotional well-being of young people of color. This event is being presented in partnership with the Steve Fund and jointly with GBH News. We're streaming live, you should know that, online on the platforms of the Forum, GBH News, and The World from PRX and GBH. We're also streaming live on Facebook and YouTube. A little frog in my throat there. Sorry about that, folks. Folks, you can also email questions to the forum at hsph.harvard.edu. I'm going to repeat that. You can email questions to the forum at hsph@harvard.edu. And I'm going to see if we can get down the screen later. Today's discussion is the second part of a two-part series during which we have examined how to support the mental health needs of young people of color, particularly during the pandemic. Last week's discussion focused on what corporate leaders can do. Today, we're exploring what higher ed can do to help young people of color successfully navigate today's campus climate, social distancing protocols, and remote learning experiences. What levers exist to support a smooth transition from school to the workplace? Because the pandemic is hitting communities of color harder than other communities, as we well know. Let's pause for just a second to consider this quote from APM Research Lab. If they had died of COVID-19 at the same actual rate as white Americans, about 21,800 Black, 11,400 Latino, 750 Indigenous, and 65 Pacific Islander Americans would still be alive. That's a quote from APM Research Lab. So what has the pandemic meant for college students of color, who now represent 45% of undergraduates? Last spring, campuses were abruptly shut down and most students living on campus were sent home as schools transitioned to remote learning, cutting them off from friends, faculty, and staff, from on-campus support services, and for some, from reliable food and housing. At the same time, students are wrestling with what our country's racial reckoning means for them, with the stress and trauma of police violence, and with the opportunity to take on roles as agents of change. College students of color are experiencing pressures and stresses like never before. And at the very same time, they've lost access to many of the systems that are in place to help support students' mental health. Today, we're going to look at what it's like to be a college student of color right now and what college and university leaders can do to help support students during the pandemic and beyond. Let's start with a clip in which we'll meet Damien, who has bipolar disorder. He came to campus with a mental health challenge, but found that trying to find appropriate care at school was difficult. This clip is courtesy of the Steve Fund.
Seeking help at school, whether it be the on-campus therapist or even just my advisor, there were times where I would contact somebody and I wouldn't hear back from them for weeks about what is going on or anything like that. I would reach out to my advisor trying to seek some type of guidance. She would point me in one direction and I'd get pointed into another direction. It just feels like this endless cycle of you being sent in this circle, and you're just always, your head is always spinning because you're always trying to find something. And somehow you need to do all of this while also turning in an assignment on time and not breaking down completely. And when I finally did get into contact with the on-campus therapist, I realized that you are only given a a certain amount of sessions with them. I basically only have 10 times for me to have a breakdown, and then all of a sudden this therapist is gone. Ultimately, all I need is just someone to talk with for 10 minutes, and they don't even have that. So all of these different elements make it very difficult to see college as a safe place.
See college as a safe place. Tabby, you've examined data on the mental health of college students of color. What are the big issues on campus, and how are these challenges playing out in this moment, this sci-fi moment, if you will?
Sci-fi moment indeed. Well, in the research that my team and I have done, we've looked at national data sets such as like the Healthy Mind Study and regional and local data, and we see similarities. We see students from historically underrepresented groups, Black, Latinx, and Native American students being most likely to report negative affective experiences related to their campuses, feeling less sense of being valued, belonging, that they're thriving and growing. And we see these patterns among both undergraduate and graduate students, representing a broad range of emerging young people being impacted by campuses that are unwelcoming or where they feel their cultural backgrounds and contributions are devalued. I also want to say that while we're focusing today on students of color more broadly who can have shared experiences, we're finding it important to also disaggregate research findings for different racial ethnic groups to help us consider variation in the nature of students' experiences, which may be based in societal images, stereotypes, and historical statuses around the different groups. For example, our work makes salient how anti-Blackness may uniquely impact Black students, showing up in their experiences of being treated with fear and suspicion, policing and monitoring, interactions based on anti-intellectual stereotypes. Asian and Asian American students may experience xenophobia, now exacerbated in the current COVID-19 times. Indigenous students often report feelings of invisibility or erasure, and Latinx and Middle Eastern and Arab American students may be particularly likely to report anti-immigrant treatment, regardless of their actual immigrant status. While certain groups may have more common experiences, no one experience is unique to one group. And within a group, students may vary in their experiences. So it's complex, but embracing this complexity is really important because understanding the shared experiences and variation that students of color experience can support our efforts to intervene and positively address the spaces, places, and actors that impact them. Unfortunately, the intersections of racial unrest, COVID, and economic crisis make these challenges that I just mentioned greater. As institutions move to remote and hybrid remote in-person learning environments, they still must be accountable for attending to new and different ways that students of color may experience the campus and the racial climate, particularly those from communities that are disproportionately impacted physically, financially, or emotionally. For instance, offensive comments, incivility, harassment, and tokenizing behaviors can still show up in online learning environments or in socially distanced living spaces. So the practices of faculty, instructors, and staff should incorporate knowledge of how these issues may uniquely emerge in these new kind of COVID-induced environments. And finally, I'll say that our research also highlights how many students of color draw on their racial cultural identities and their communities as a source of strength and resilience, supporting their well-being and adjustment, which is something that is missing or harder to do during our COVID times. So as institutions respond to COVID, they must be creative in supporting culturally affirming spaces and structures such as group organizations, access to ethnic studies and cultural knowledge spaces, and also informal opportunities for students to community build with other peers, faculty, and staff of color. It's a challenging time.
It is a challenging time indeed. Thank you, Tabby. A horrible, perfect storm. Marvin, as a university president, what can higher education leaders be doing to help address some of these challenges that Tabby talked about?
So thank you very much. And I was very pleased to be part of the Steve Fund report, which really emphasized the importance of higher ed acknowledging the challenges posed by the pandemic to students of color, particularly Black students, and really to embrace the challenge and to be very intentional about that. And so one of the things that we understand is that this time has been particularly challenging for first generation, low income students of color, whether it's through the illness, the availability of technology, social justice questions, financial challenges, and also the sense of community that Tabby just talked about can be much more challenging in a remote environment. We know that peer mentoring and informal contact between faculty and staff has been reduced. And so we need to be able to really commit to trying to increase that. And so we as an institution, and I think most institutions, have been called upon to be very careful and very clear about really trying to think about the needs of the students. And we know that many students of color have dropped out, and that low-income students have been disproportionately affected. And so what we know we need to do is really commit as an institution and as a community to reaching out and making sure that students have the support they need. Because the consequences, if we don't, are very significant, not just for the individuals and their families. We know that college graduates earn much more money, have much more financial stability, but we also think that there's really something important at stake for the country, including the loss of human capital and the further divide between us, as well as the loss of productivity.
Marvin, thank you very much. I'm going to direct this next question to Josephine. Uh, Josephine, what systems and practices are embedded in higher education that actually can work against the mental health of students of color? And how can universities turn that around?
Sure, I love to use the World Health Organization social determinants to really frame our understanding of mental health of students of color. So social determinants, as they define it, are the conditions in which we live, learn, participate, socialize, grow. And we know that these conditions are shaped by distribution of power and resources, representation, a sense of inclusion, and a sense of belongingness. And inequities in these conditions are responsible for the disparities that we see in health, including mental health. So I want to parse out the structural determinants and interpersonal determinants that really fall under social determinants. For example, structural determinants include structural racism. A large part of structural racism it goes back to the lack of representation. It's already been mentioned, but if students of color don't see themselves reflected on the walls they have to navigate, in the curriculum, in the authors who wrote the materials they have to read for class, when they're physically on campus, in the food that's in the cafeteria, if their identity and collective strength and resilience, as well as their historical trauma that they're bringing, if that's never acknowledged and recognized, and also if they finally muster up the courage to seek help, as we saw in the video, and to seek support, but they can't readily find a therapist who reflects facets of their identity, then all of this does point to a lack of inclusion and poses a threat to the mental health of students of color. When the conditions are such, a culture of stress goes up, imposter syndrome is felt more strongly, minority stress goes up, stereotype threat is felt at a greater level. All of this, again, leads to poor performance and poses a threat to the mental health of students of color. Self-psychology says in order for us to thrive and fully participate in life at our full optimal selves, we need multiple things. For example, we need people to mirror our feelings. So if I'm hurting and if I'm being triggered because of what's happening in society, the racial unrest, maybe I've lost someone because of COVID, and these hurts and feelings are not being reflected back to me in the circles that I dwell and live and grow, then that says I can't be at my optimal self. It also means that I need to feel a sense of likeness, that when I enter a Zoom space, that there are people who reflect different facets of who I am and my identity in order for me to feel, right, that I belong and that I'm included in this situation. Of course, then that leads us to the interpersonal determinants. So things like implicit and unconscious bias, we all carry them. We are all racist. Right? Even if we're people of color, we've been socialized to believe that whiteness and our proximity to it right? The closer you are to whiteness, the better it is for you. And so we've all tried to live that out. And unless we really take the time to unpack that for ourselves, that becomes our default way of being. Of course, we know microaggressions, which has been described as a death by 1,000 cuts. And so it may not be maybe blatant racism in some ways, but these microaggressions, the stereotypes, as was mentioned, the tokenizing, all of these things, the burden of carrying an entire culture on your shoulders, all of these things, again, impact the mental health of students of color. And of course, social exclusion. We know the new discrimination in town is the absence of helping. And we saw that in the video. So people who are like us, people who remind us of our younger selves, for example, we might really go to the bat and go to the mattresses to support them, whereas we might stay silent for other students who don't reflect who we are and who don't remind us of our younger selves. And that absence of helping is the new discrimination. So all of these things, again, pose a threat to the mental health of students of color.
It's a lot, and all of you have pointed out quite a bit, and we can only imagine that it's all exacerbated by the issues in this election, especially those focused on hate groups and white supremacy. Mita, you and your team at the University of Chicago are working directly with students and trying to support them through this crisis. We should say multiple crises. What are you hearing from them exactly?
Thank you, Philip. Hi, everyone. So to just start out, I'd like to thank the Steve Fund for just convening such a representative task force that included multicultural mental health clinical experts of different backgrounds. So today I bring the perspective of counseling center trying to serve the array of mental health needs of students at a college counseling center. So to remind everyone, what we are seeing sort of really at a human level is the psychological and emotional toll of coping with the multiple layering effects of these different crises, the racial reckoning, a pandemic, and economic stress, each significant in its own way, but the combined effect is monumental. And this is all just to remind us, is that students are also trying to cope with academic demands. And I also want to add that there is a disruption to the normal developmental process, as college typically is a time of growth, developing healthy peer relationships, exploring identity, and developing self-efficacy. So while all students are struggling with pandemic-related stressors like isolation and fatigue, there are additional variables that impact mental health of our color and marginalized communities. So we are seeing a wide range of mental health concerns, amplified stress, anxiety, depression, grief, and trauma. Students feeling overwhelmed by trying to make a variety of different choices for themselves and for others, desperate, hopeless, and having difficulty functioning. As Tabby mentioned, the impact is disparate across different communities as there are unique contextual factors at play. So just to give you a little bit of a snapshot, our Black and African American students experience long-standing racial trauma oftentimes and are experiencing heightened feelings of anger and urgent need to take on issues of activism. Latinx students, often first in their families, may have additional responsibilities to care for family members while being students. Asian students have been reporting increased harassment and hostility and xenophobia. Native American populations have been ravaged by coronavirus losses. International students, heightened anxiety and uncertainty about their futures. LGBTQ+ students struggling to find community and cope with families who may be non-affirming of their identities. And then there are intersectional stressors, as we have all been seeing the increased violence against Black trans folks. So the pandemic has literally provided a window into the worlds of our students, which are often impoverished, chaotic, unsafe, and lacking in privacy. And we know that mental health and wellness affect students' ability to cope with academic demands and persist through college. So despite the disproportionate burden of mental health needs, students of color also utilize services at a lower rate than their white peers. And this is due to barriers in seeking care, historical mistrust of mental health and healthcare systems, sometimes just lack of awareness, stigma and shame associated with seeking help. Through the work of the Steve Fund Task Force, it is important to emphasize the need of trauma-informed leadership and for a collaborative approach to promoting mental health for students of color during this time.
Mita, thank you very much. Panelists, thank you all for those insights. And now we're going to have a chance to take a deeper look at these issues and some of the changes that can help colleges and universities support the mental health and the careers of people of color. Now, before we do that, let's watch another clip. Here we will meet Tanez, a student. That's his name, Tanez. He's a student with stressors at home, including responsibilities helping a mother with mental health issues and a need to work while at school. This clip is courtesy of the Steve Fund.
I had to grow up very quickly and didn't have anyone to guide me. I didn't have that space to find what universities or majors did I want to explore. The support I would have liked or feel like that I would have needed from school is maybe a mentor or have more accessibility to these counselors that we're assigned who know us a little more in depth than we're just a number out of 50 students that they have to see because they rearrange us by our last names. Someone who would have the time to sit down and hear what my struggles are and help me brainstorm what can I do differently. What supports does the school offer to help me answer questions that I have and I don't know where else to look.
I have nowhere else to look. Wow. Folks, before we begin the next part of our discussion, a reminder that this is the forum at the Harvard T.H. Chan School of Public Health, presented in partnership with the Steve Fund and jointly with GBH News. Viewers can email questions to and these organizations. You can email both questions and you can email directly to the Harvard T.H. Chan School of Public Health and GBH and the Steve Fund to the forum at hsph.harvard.edu, the forum at hsph.harvard.edu. Now, the Steve Fund, our partner today, recently convened a crisis response task force that made some specific recommendations about how colleges and universities can support people of color. One of those recommendations has to do with investing in student mental health. The woman we saw in the clip spoke about her desire for support that felt more personal from someone who knew and understood the challenges she was experiencing. Now, Marvin and Mita, please tell us more about what kinds of investments could help create the kind of personalized support that she's seeking.
Do you want me? Okay.
Please.
Thank you for the question, Philip. So we do know that there's a strong economic case to be made for just investing in just infrastructure and staffing to support the mental health needs of students of color. We know that there's increased likelihood for students dropping out of college. It affects their ability to be academically successful, go on into the workforce, et cetera, et cetera. So investments just in infrastructure, having enough supports available, having representation of staff is critically important, intersectional representation of staff. And then there's also other investments in just thinking about multifaceted services, that there's a range of options to address barriers to seeking help and also complex help-seeking behavior of students, which may mean having informal drop-in options for students, 24/7 access, thinking about local area providers, insurance plans. Other investments could be just developing strategic priorities and goals to support collaborations across campus The idea of relationship building, having linkages across campus is incredibly important in and creating a network to support students and get them to help when they need them. And the lastly I'll talk about are the perception issues. Sometimes there are resources available, but having adequate messaging and information being available to students who may not know the kinds of help that's available because they come from communities where this has not been historically either accessible or it's not been something that's really supported. So all of those investments could be critically important.
Yeah, I would add on to what Mita said that I think part of it is making sure that it's not stigmatized to seek help for mental health and well-being. And there's a phrase that a lot of people have said, which is, it's okay not to be okay. And saying to people that your feelings, whether they're directly or indirectly related to the pandemic or the racial injustice, racial and social justice reckoning that's going on, that it's okay to seek support. And whether it's through peer mentors or other avenues to try to be part of that discovery and the part of well-being. So I think some of it is just making sure that the institution embraces the notion that this is part of our mission, this is part of what we give to the community. The other thing we talked about at the Steve Fund is trying to have employers and outside forces also understand that this is part of their mission as well, to be accepting and to understand the needs of a diverse workforce.
Marvin and Beta, thank you very much. Tabby, as you work with faculty at universities around the country, do you find that they are actually invested in these ideas? And if not, what can university leaders do to help change that?
Thank you, Philip. I would say yes and no. I would say yes, in that faculty are increasingly aware and concerned about mental health as a critical issue in higher education, are becoming more aware that there are unique mental health challenges among students of color, but also no, in that faculty are often less clear about their roles in relation to these issues, generally or specific to students of color. For instance, faculty often view like the campus racial climate experience as something broad and diffuse that affects students, but that is beyond their personal control or purview, when in fact, the data show that students' climate experiences often implicate the classroom. For example, racist or racially insensitive faculty-student interactions, or the lack of faculty kind of facility in navigating racist peer dynamics. Faculty are often unaware that those types of stressors have strong implications for students' engagement, belonging, thriving, and mental health. And also the traditional faculty socialization, especially in some disciplines, doesn't include the need to understand students' backgrounds, experiences, and challenges, and how they might impact engagement or adjustment. Students are supposed to, and particularly students of color, classrooms are neutral, so students are supposed to leave their identities outside the class, which we now know is actually not conducive to optimal learning or well-being. That said, we are finding that engaging faculty with the research from a student voice perspective helps them understand how the classroom context affects students and the specific roles that they can play in more inclusive environments. So in some cases, it's helping them become more knowledgeable about the mental health support services that are available so they can point students to them, not asking them to become the counselors, but also to become aware of the things they do in the classroom and have control over that impact students. And then I will say structurally, we also see more faculty engagement when their institutions at college and department levels support and incentivize inclusive classroom practices. So for instance, through providing quality teaching support resources around inclusive pedagogy, appropriate time release or credit for faculty who do the work in this space versus it being just on top of their regular workloads. So the faculty who care about these issues do extra work that's uncredited, and recognition of this kind of work as high quality and prestigious in review or promotion structures. So when faculty are actually supported, incentivized, and recognized for doing this work as important work, they're more likely to do it compared to when it's invisible labor, additional workload, or when they're not high quality resources to help the faculty learn how to better engage in these issues.
That's quite a summary. Tabby, thank you. Mita, all of the practices that we're talking about are, of course, complicated by the fact that due to COVID-19, many services can only be offered remotely. So what are the challenges of using technology in the mental health space? And are you seeing innovative solutions that really make technology work to support students?
Yeah, thank you for that question, Philip. So we've experienced a transformation in our service delivery methods with the need to adopt virtual platforms. And literally across the country, as the pandemic hit, we have shifted all of our mental health services pretty much overnight to synchronous audio and video platforms. So we are providing teletherapy, telepsychiatry, individual couples, workshops, and we have several months of experience doing this now. And I have to say that this has provided a fairly effective means of taking mental health services into student spaces, into the privacy and comfort of their homes and their rooms. It provides, again, a way of making services much more flexible and convenient. So it for sure enhances the access to services. Now, having said that, there are various challenges in doing this. Clearly, we are doing better with more practice at doing this. We are also dependent on the devices that students have. So there's a financial piece here, Wi-Fi networks, which are variable, access to confidential spaces, which are also variable. And we've seen that students sometimes just don't have the spaces to even have quiet and private conversations. And then there's Zoom fatigue, because everybody is now on their devices all day long. So even though this is an access to getting emotional support, it's one more piece of needing to connect on technology. So we do see that. And again, for students where this has historically not been something that has been supported or part of their emotional support mechanism, that there can be a little more wariness now of needing to do this over virtual platforms. So it's a little bit of a mixed bag. There's also been interstate licensure laws that regulate and limit access of teletherapy across state lines. So, it's a mixed bag.
So, Josephine, that mixed bag, the technology, what are your thoughts? You have to unmute that.
Yes.
Okay. All right. No problem.
I was going to say, as a faculty member in the classroom, it really has changed the landscape of how we teach. One, it's difficult. You can't walk into a physical classroom and just kind of scan the room to see how everyone's doing. Now, when you really want to check in on a student, you do have to make that point of contact. And so it's another Zoom meeting or it's another phone call. And we have to be very intentional and make time for that now. I think it's also highlighted economic disparities. I'm hearing students who say, I don't technically have a room I can dedicate to my classes where I can sit in quiet and peace and participate in classes because there's family around, or they're having to take care of their younger siblings. They're working full-time jobs, many of them are, to support parents who have been laid off. And I'm hearing stories of how they're sitting in the car or going to a public library or finding ways where they can tap into some sort of Wi-Fi. And so I think it also highlights the need for universities and institutions to create different funds where students can tap into those funds related to fully participating in class and not assuming that everybody has access to those things. Again, I want to highlight that it's really difficult now to see who's struggling. You really do have to make intentional points of contact with students. And for me as faculty, what that means is I will start my classes 30 to 45 minutes early and also stay about 30 to 45 minutes after class, just to say if anybody wants to meet with me, any questions about anything, or just to see how you're doing and want to share that, especially with everything that's going on, then those are dedicated moments where students who want to drop in can do that. But again, we just have to have more intentionality.
Yeah, you talk about these spaces. That's a good forms another question I'd like to ask Marvin and Tabby, which is, some of the changes we're talking about happen as you say in the counseling office, some in the classroom, some elsewhere. But of course, students don't spend the majority of their time in either of these spaces. What about the other parts of student life and the other departments that serve them? Who'd like to take that? Tabby, Marvin?
Do you want to try?
You get that?
I mean, in terms of, I'm not sure exactly what you're asking, but I will say,
well, think.
go ahead.
I mean, they, as Josephine pointed out, you have it's they're on the work. You have students who are working. You have students at other
Yes.
other settings. So they're not just confined to one space where their mental health is being challenged. It's multiple spaces. And so, what about those parts of their life and the departments that serve them? How are they served in that context?
Well, I think we all have used remote to try to do everything, not just counseling, but advising. We also, I mean, I'm teaching myself in the high flex mode. And so I'm like Josephine, trying to be very present for the students. And frankly, I do think that this time demands even more of us in terms of really reaching out affirmatively to students and asking them, if a student doesn't appear in class, I ask them, is everything okay? And that's probably best practices anyway, but particularly in this moment, I would say that what we've also tried to do is really to think about their lives holistically. And so we do try to create both physical and emotional spaces for students on campus so that there are some socially distant hangout places. If students want to go into an empty classroom or there are lounges, but I mean, it does create, there's an unusual aspect of it in that we can't have the physical closeness that we would normally have, but we are trying to create spaces for students to be with each other, because I think that that's the hardest part about this new reality, is that students want to be close to each other. They want to interact. And yet the world tells, I mean, the health organizations and all the doctors tell us that we can't do that. And so what we're trying to do is create alternatives to have this kind of physical and emotional contact, or maybe not physical, but at least emotional contact.
Tabby?
Yes, I guess the things that jumped into kind of my thinking as you asked the question were about things that are not a result of COVID, but that are exacerbated by COVID. The ways that our structures on campus are often so decentralized or separate, and that with COVID, we're having to work harder to even make connections across spaces that were already disconnected. So thinking about the spaces where students occupy the spaces they occupy from day to day, and how they can better connect with other spaces. So for instance, the ways that some mental health symptomology kind of occur through physical and somatic symptoms. So students feeling sluggish or sleepy, or, versus some, quote unquote, stereotypical or traditional indicators of mental health challenge. And so people who might be in housing or in, resident advisors may be the first ones to recognize some of those challenges. And, how are we equipping our different kinds of spaces to recognize potential challenges and then direct students to the right places, or communicate with those other spaces, such as student life or counseling services. The same thing with faculty, beginning to, as they check in on students, recognizing that there are a broad array of ways that mental health challenges may manifest, so that they can at least normalize students seeking supports of different types. So in relation to diversity, equity, and inclusion, there are lots of efforts to support student equity and access that may, I think one of the terrific works of the Steve Fund is that it has begun to make institutions conceptualize access to mental health care as a part of an equity and access and inclusion agenda in ways that institutions may have kept distinct before. So student challenges related to diversity, equity, and inclusion are not necessarily connected to access to resources and supports for well-being. And I think that is changing in ways that are creating more opportunities for those types of offices on campus to connect with student life, for mental health and counseling services. So I think there's some positive action that's happening now. And maybe, and some of that positive action has happened as a function of COVID in terms of people having to connect in different ways that they haven't had to connect before in order to give people kind of basic supports and services.
Right. One of the other issues, of course, that's weighing heavily on students is the racial trauma they're experiencing. I mean, we're hearing the chants, hands up, don't shoot, I can't breathe, Black Lives Matter. And the racial reckoning that's happening in the United States right now has really been an awakening for many people, and also a call to activism. And I'm wondering how is this affecting students of color right now, and what can universities do to better support these students? Mita, Josephine, I'm going to direct that to you.
Yeah, thank you, Philip. And student activism has always been powerful on college campuses. I think it provides such an opportunity, not just for healing, but for empowerment, to live a life of purpose, develop advocacy agendas, be change agents on campus. So that's powerful. And many gravitate towards student activism due to kind of personal experiences of struggle, of their own history, especially with some of the issues. So the issues often tend to be really, really personal for students. It can also be extremely hard on several fronts because activism takes time away from other things. There's physical as well as emotional labor involved in being agents of change. It can be exhausting. Change takes time, so it can be demoralizing that there may not necessarily be immediate outcomes for things that you're really working hard for. So, it can be a little bit of a double-edged sword. I do think, especially with the pandemic, I think if higher education institutions can work closely with students and with advisors to offer them support, to offer them services, to think about activism again as a multifaceted thing where they perhaps have different choices and different opportunities to be involved, that it doesn't need to be sort of a one size that fits all. So students can pick thoughtfully and carefully as to something that would really fit kind of their individual needs, provide some leadership development opportunities here for students, and trauma-informed training. So I think really supporting students and making good choices, but looking out for their safety in the process and providing adequate guidance and support and information can really go a long way.
Yeah, I think it's important for us to remember that institutions are microcosms of society. And so I think the worst thing we can do at this moment is to replicate what they're experiencing out in society and seeing on the media happening in our classrooms and in our institutions. And so making sure that there aren't parallels that will become triggering, I think, in classes and in conversations, all of those things. I also want us to be careful that we don't assume fragility in our students of color, because remember, they've had to navigate so much in life already. So they're bringing in so much strength and resilience. And so there are times when I've heard students of color say, can I please just have a lecture, like 100% lecture where I'm learning and, I don't have to engage in this conversation all the time. And I think what that highlights for me is to really engage them in the process. What is it that you really could benefit right now? What would be the most beneficial to you? Nothing about them without them, right? For them without them. Again, involving them in that conversation to see what it is that they might benefit from in the moment. And I think they really are looking to see that institutions are making routine progress, that this isn't just a reaction to what's happening in society in the moment, but that the change is prolonged and is sustainable, and that that progress is in for the long term.
Thank you very much. Marvin, just briefly, can you comment on the anniversary of DJ Henry's killing? This was a young man who was shot, GBH News concluded, unjustifiably 10 years ago this month. And he was a Pace University student, very well liked. DJ Henry, now the case is being asked to be reopened. How are students responding to this case?
So thank you. It was a tragic event that occurred, as you said, 10 years ago. DJ was a student athlete, a football player who was shot and killed by an off-duty local policeman. And there was a civil suit, but there was not a criminal prosecution. What we've done is really worked with the students and the faculty and staff to use this tragic event to try to talk about social justice. And so there was a student-run event commemorating 10th years of his death, but also this week we kicked off a social justice week pegged to his birthday. And there had been a focus on social justice in the career services, career fairs, opportunities for dialogue. And really, it's part of our effort to be as strong an institution, to be a diverse and inclusive institution, to be an anti-racist institution. And so working with students and faculty and staff, we've tried to take this terrible, terrible, terrible event and use it as an opportunity to make ourselves better and to also reflect on the world around us. And so there have been a lot of very, I think, moving and productive discussions that have taken place.
And so, Marvin, of course, students are also dealing at pace with the pandemic crisis that we're experiencing, and it's affecting people at all life stages. And that also includes high school students getting ready for college and new grads who've just entered or want to enter the workforce. So what are the risks to young people at these transition points, and what can colleges and universities like PACE do to help students make these leaps?
Well, Philip, I couldn't agree with you more. I think we're all worried about a lost generation, particularly among working class, first gen Black Americans and students of color. So what we've tried to do is play a role in the community. Last summer, we had a program for college readiness that reached out remotely to a major employer's, the children of a major employer, tried to talk to them about everything from filling up the FAFSA. You know, this past year, there's been a drop in the number of students filling out the federal FAFSA, which is a bureaucratic device, but it is what gets people financial aid, which is so critical for working class families. And so we talk to students and their families about what it takes to get ready. And of course, on the other side, the exit side from college, we continue to do a lot of work with that, inviting different employers on campus, and also really trying to prepare students for that entry into the workforce. And it is more challenging because we don't have the physical contact, but it's amazing how resilient and adaptive the students have been. But I think it's very clear that it's not just the universities. It really needs to be a partnership with K-12. It needs to be a partnership with local government and employers. And I really think this is a moment for our nation to step up and say we are really committed to a more equitable nation, an inclusive nation. And I'm hopeful that we who have been part of this can be magnets for that, or at least part of the solution, if you will.
Thank you. I appreciate that. Folks, let's turn to our viewers right now. There are quite a few questions here, and folks are eager for you to answer them. Let me just take a look at one of them. This is from Miranda. She asks, given the situation with COVID, where counselors may also be dealing with their own stress, young children at home having to school them as well, how are schools helping the helpers? Whoever would like to take that, please.
I can start. And this has clearly been another dimension of the issues that we're dealing with, Philip, which is, we have staff members who are also extraordinarily stressed out, trying to work from home, manage childcare, staff of color who are also experiencing distress and trauma. So I think it's a systemic issue of needing to look out for the wellness of all and making sure that we are creating spaces to support staff wellness during this time, give them some flexibility, have appropriate expectations around workloads, naming some of the issues, having conversations. So from somebody who's like running the counseling center, it is both, we are looking out for the students, but we are also needing to look out for the care providers who are caring for the students during this time. So all very important part of the work that we are doing these days.
Indeed. Anyone else care to opine?
I was going to say, for me, I think it means that institutions need to hire more people and cut down on the caseloads. I think that's the only way we can balance what's happening right now. And if it means you have several students or a big population coming from a different location in the US, maybe this is a time to hire counselors in that area so you don't deal with licensure issues and that doesn't become a barrier to seeking services.
Okay. We'll go to our second question then. This is from Byron. Would it be beneficial to provide behavioral health screenings to students from K to 12 through college, university age, and a minimum of once a year? Whoever would like to take that on? Tabby, Marvin?
I think Mita had chimed in for that.
Oh, I'm sorry. Go ahead, Mita. Please, please, please. Your microphone.
I think screening is one part of the whole issue here. Of course, early identification can really go a long way in getting students to help sooner than later and investing more early on in K through 12 for sure. I think if you think about sort of systems-wide, addressing systems-wide issues, I think that's an important piece. But apart from just the screening, I think having access to supports and resources. So again, I think it requires multifaceted solutions and strategies here, screening just being one of them, because again, that's just sort of a part of a larger whole.
And I would just only add. Oh, go ahead. Go ahead.
Oh, go ahead, Tabby.
Please.
No, please go ahead, Tabby. Well, I was just going to quickly add that.
Tabby, then Josephine. Go ahead. Tabby,
Yeah.
then Josephine, please.
Josephine and I are often on the same page, but quickly, I would just say some of the same themes that we've been talking about for higher education around the need for coordination of different spaces that serve students, increased awareness among practitioners, teachers, counselors around, and families about what mental health and mental challenge symptomology and how they may manifest, and how to recognize and connect students to appropriate resources apply to the K through 12 space too. So just say the things that we've talked about earlier would apply to beyond screening, but including screening might would support students during their whole academic pathway.
Okay.
Yes, I'm definitely feeling this. I'm definitely feeling the sense of twinship here with Tabby. Exactly what I was going to say. I think in the least we can provide education for teachers on mental health literacy, really making them aware, and how you might do this over Zoom.
All right. We have a question from Ariel. This is from online. She says, I'm worried that our generation of young Black people is going to be permanently affected by the trauma of racial killings and the racial inequities that COVID is exacerbating. And now we are facing a situation. Let me see. Excuse me one second. Did I lose her question? I lost part of it. So let me move up here just a second. Sorry, folks. And now we are facing a situation where education is being disrupted by the pandemic, and we may not be able to find employment when we graduate, given the state of the economy. Here's the question. Is there any research on the long-term mental health effects of these types of dislocations on a whole generation? Josephine, you were talking about this earlier, as was Marvin. Please go on. Whoever would like
Josephine, Josephine, please.
I saw your mic off, yes. I was going to say, I think this pandemic for all of our generations that are alive right now is such a new thing that I can imagine more and more research will come out. As of now, I mean, we can imagine what those impacts are, and certainly we're feeling the brunt of it right now. But I imagine it will be a lot greater than what we even can imagine right now. Yeah.
I would say that, yesterday we had Mark Morial from the National Urban League speak, and I do think that talking about the situation in a historical framework can also be helpful in terms of understanding how people have overcome obstacles and how we have made progress, not nearly as much as we should. And I think that sometimes making sure that we have role models who can inspire younger people is very important. And that's one reason why we need to be even more diverse and inclusive as institutions.
All right, thank you. Mita, I'm going to ask you this question. This comes from Rick. What are the best resources for helping people address the family and peer interpersonal and intrapersonal dynamics of COVID stress, resilience, strain, anxiety, and depression?
Gosh, so that's a lot, and I think that's sort of what people are experiencing. And again, each individual needs something different to be able to cope with the unique circumstances and situation that they find themselves in. So I would say for sure, finding someone, identifying the issues, talking to someone, whoever is a starting point, and that doesn't have to be a mental health clinician, any trusted resource to go to address these issues can be I think critically important in developing strategies and coping skills to deal with these challenges.
Okay, folks, we're getting quite a few questions and running out of time. So I'm going to see if we can get a couple more in. This is from Lyle. Colleges can be a time when lifelong friendships are built and career networking possibilities made. What advice would you have for students of color in particular to build these relationships in the absence of campus life? Whoever would like to take that on, please do. And raise your hand. Let's do that. How's that? Okay, Tabby?
So I would say, so I think there are kind of a couple of conversations, some among student groups. So I think from an informal and organizational perspective, drawing on existing organizational groups to help host, facilitate, connect students of different cohort years and kind of generations, and those can be spaces that are already existing structures for, and I think many of them are conscious of the fact that there's a kind of a new call during COVID for them to, and a new role and a new positive role for them to provide that. I've also been in spaces where we've been having lots of conversations with faculty and staff of color who are also wanting to support network building and connection among students of color. And so actively engaging with faculty, students, staff, it may be from organizational perspectives, through affinity groups, or through personal interactions with faculty and staff, explicitly kind of asking them to play a more proactive role in promoting connection, introducing to networks. This is something that I often do informally on campus when I run into people, but we're not running into people kind of in the same way. So I think that there are lots of roles that existing organizations, informal relationships, people are interested and actively willing and want to be a part of creative solutions with Zoom or with other kinds of virtual tools to help support connections and networking, which we know is a part of healthy development during college, but also a part of supporting people's engagement and success.
Okay, thank you, Toby. We're running out of time, unfortunately. In fact, we've run out of time. And I'm wondering if we could get a takeaway from each of you. And I'm wondering if it's possible to include this last question in your takeaway. Why are students of color at greater risk for anxiety and depression? That question from Chelsea. And if we can get, again, your takeaway from today's session, and perhaps reflect on the question that's been asked. Let's start with Mita, and then we'll go to Marvin, Tabby, and Josephine.
Yeah, thank you, Philip. And I think for all of the things that we've been talking about, I think just, the different variables that are affecting mental health of our color communities, I think do create additional vulnerabilities and put them at higher risk for experiencing different symptoms and symptomatology. So for my takeaway, I would say it's, from our conversation, clearly the needs are urgent and they're multifaceted. And require multifaceted solutions and engagement of multiple stakeholders in this process to develop a vision moving forward to support our communities and their futures.
Marvin?
Well, I think we know that there's ongoing discrimination and the vestiges of discrimination that continue to plague us as a country. And that's seen in many, many different aspects, financial as well as others. And I think that colleges and educational institutions are one of the places where we have the most opportunity to really make a difference and to give people opportunities. And we do need to be intentional about them, and we do need to create networks and connections, as well as lifelong friendships and relationships, whether it's with faculty or students or staff. And I think that all the external forces need to be part of that, but I do think that if we can create a model, a diverse, inclusive, and equitable model, that's the kind of thing that will stand students in good stead as they move throughout their lives.
Debbie?
So college is a stressful context. So all students who enter college experience lots of social and academic stressors, and for students of color, they're experiencing those along with challenges in the broader society related to their identities, and those challenges also seep into their campus spaces, so which creates a different type of risk. Students enter these settings with agency and strengths, cultural strengths and personal strengths and resilience, but it shouldn't only be on them or on their backs to have them adapt successfully. So we have to invest in creating settings that are culturally inclusive and welcoming. And if we don't invest that way, we actually might end up exacerbating the challenge, the stressors and the negative impacts of the stressors that many students of color may experience. If we do invest, we could be a space of solace, support, resilience as a campus to support students' individual resilience in ways that help them move forward to meet the goals that they've set for themselves. So this investment is worth it.
And Josephine?
I'm going to say nothing happens in isolation. We are accumulation of all of our histories, and it's really about where do we locate the problem. If we locate it in the students of color and say it's your fault that you're weak and you're frail, then we begin to pathologize the students. But if we accurately locate the problem in the systems in which we have to live and grow and learn, then we realize that it's actually not the students of color, but it's the systems that really impact their mental health.
This has been a great panel. I want to thank all of you for taking part in it, and I want to thank our viewers. This has been an extraordinary session, and of course, this concludes this event. And I want to thank everyone, all of you who joined us today, and to our wonderful, wonderful panelists. Thank you to the Steve Fund, GBH News, and the World from PRX and GBH. Join the forum again on November 20th for a discussion about the race for the COVID-19 vaccine. Latest updates. Thank you. I'm Philip Martin.